The broadcast is now starting. All attendees
Hi everyone,
listen-only
welcome
mode.
to the Morris Animal Foundation webinar, Lymphoma, a cancer you should know more about. Today we hope you will learn more about this common yet potentially dangerous cancer. We will give you the tools to properly identify this disease, and we will explain which treatment options are currently available. Last, we will discuss Morris Animal Foundation funded research on lymphoma and ways that you can get involved to make a difference and put an end to pet cancer. My name is Liz Mayon, and I'm the Donor Relations Specialist at Morris Animal Foundation. I will be introducing you to today's webinar and our presenter, Dr. Kelly Deal. Before we get started, we do have a few housekeeping items to quickly review. To eliminate the background noise, you will be placed on mute. If you have a question at any time, please use the chat feature located on your screen. At the end of Dr. Deal's presentation, we will have time to answer a few of your questions. Any questions that can't be addressed today will be answered by email within the next week. Next, I would like to tell you a little bit more about Morris Animal Foundation and how the science we invest in improves the lives of the animals we all love. Then Dr. Deal will educate everyone about lymphoma, followed by a short question and answer segment. Founded by Dr. Mark L. Morris Sr. in 1948, Morris Animal Foundation is a nonprofit organization that invests in powerful science to advance veterinary medicine for companion animals, horses, and wildlife. Throughout our history, we've invested in more than $92 million towards more than 2,300 studies. At this time, Morris Animal Foundation is funding about 240 animal health studies that were rigorously reviewed by a volunteer scientific advisory board to determine which studies have greatest merit and potential benefit. Ultimately, Morris Animal Foundation depends upon the generosity of our donors, and we simply could not do this without your support. The topic of today's webinar is lymphoma, which is a common form of cancer that can manifest in many different ways in our pets. Morris Animal Foundation believes that every pet deserves a long, healthy life. Unfortunately, because of diseases such as lymphoma, this isn't the reality. A fact that you may find surprising is that cancer ends the lives of more dogs and cats than any other disease. Furthermore, just like in humans, the cause of cancer in pets remains relatively unknown. Overall, there is simply not enough research around pet cancer, and that is why Morris Animal Foundation is taking a stand and uniting to fight pet cancer. We believe that by coming together and fighting back against pet cancer, our collective power can really make the difference. Later on, I will tell you a little bit more about how you, our viewers, can get involved and make a difference, but first, I am very pleased to introduce you to Dr. Kelly Deal, today's webinar presenter. Upon receiving her DVM from the University of Tennessee, Dr. Deal completed an internship at the Animal Medical Center in New York and then a residency in small animal medicine at Colorado State University. After completing a 3-year NIH postdoctoral fellowship at National Jewish Health, Dr. Deal joined the staff of the Veterinary Referral Center of Colorado as the co-owner of the internal medicine section. After 14 years, Dr. Deal left private practice to pursue a career in medical communications. Fortunately for us, though, she joined the Morris Animal Foundation team last fall as a foundation-funded researcher. Dr. Deal lives in Colorado with her husband, 2 children, 2 cats, and 1 very lovable Labrador Retriever. Welcome, Dr. Deal.
Thanks, Liz. So I'm going to briefly go over our webinar outline for today. We've got a lot of ground to cover. So there is a handout available at morrisanimalfoundation.org that roughly parallels the topics that we're going to cover today. And if you missed something or you need extra clarification, if you have any questions, you can refer to this handout. The handout will be available, if not later today, in the next day or two. Today we're going to talk a little bit about what is cancer, and I think we all have an idea of what cancer is and isn't, but we're going to go over some medical definitions, and these will be important as we consider some treatment, prognosis, and facts about lymphoma. Then we're going to answer the question, well, what is lymphoma and who develops lymphoma? We'll end by talking about diagnosis, treatment, and prognosis very briefly, and then we'll conclude with a little bit about how Morris Animal Foundation is helping in the research and treatment and hopefully prevention of this deadly cancer. So what is cancer? I think we all know somebody who's had cancer or have our own opinions about it, but it is a genetic disease, meaning that cancer alters the genetic makeup of a cell and makes it do things that maybe it's not supposed to do. There is an inherited predisposition to cancers, and we know this from people, we know this in animals. Certain families, for example, are more likely to develop certain types of cancers. We know that certain breeds of dogs are more likely to develop certain types of cancers. So there's definitely an inherited predisposition. Doesn't mean that individual will develop that cancer, but given the right set of circumstances, they're at higher risk. We know that cancer is characterized by a return to a more immature type of cell. And we'll talk about this a little more, but basically mature cells, they have certain regulatory mechanisms that are in place. They don't keep dividing, they stop growing, and cancer represents a return to a more aggressive type of cell in division and growth. And we'll talk a little bit about that shortly. We know that the environment is important in the development of cancer, but it is not the sole cause of cancer. So again, a person with, or an animal with an inherited predisposition put into a certain environment might be more likely to develop cancer than if they were in a different environment where that's not going to play a role in the possible development of cancer. So I'm going to review the 6 characteristics of cancer, and if you were in here for our mast cell tumor, this is going to be repetitive, but it bears repeating. First, cells exhibit sustained growth, and think about that a little bit. We have cells in our body that once we reach an adult size, they don't keep growing. Our bones don't keep growing, our organs don't keep growing, but these cells continue growing for longer periods of time than is normal. They also don't respond to the normal signals that are present in our body and in these cells that tell them to just stop growing. You've reached your adult size, don't grow anymore. Cancer cells we know the signals are there, but they don't respond to them. The cells are resistant to normal death. All of our cells die, some at different rates than others, and that's programmed into the genetic makeup of the cell. We know that cancer cells are very resistant to these normal signals, again, that are present, but for whatever reason, they don't respond to them. Cancer cells limitlessly replicate. Our normal cells have a programmed number of replications. They'll replicate or divide for a certain amount of times, and then they stop. Cancer cells, again, seem to just don't follow those normal patterns, and they continuously replicate. Cancer cells are also good at recruiting blood vessels, and I'm going to spend a minute with this. We know that the way that our internal organs and body are organized, they need to tap into the blood system. They receive nutrients, they receive oxygen that way. So think about it. If you're a cancer and you're starting to grow into a tumor, you've got to tap into that system in order to continue growing. And for reasons which are just being elucidated, cancer cells are really good at doing this. They're very good at tapping into our blood supply, and then they become competitors with our other organs for the normal nutrients that are in our bloodstream. Cancer cells are also very good at invasion and spread. And again, think about it. Your liver cells they don't decide to go to your lungs. Your lung cells do not end up in your big toe. They stop. They don't spread. However, cancer cells, again, are really good at spreading to other tissues. They invade into other tissues. Our cells divide, and then often when they bump up next to each other, they go, oh, okay, we're going to stop moving. Cancer cells don't respect those boundaries. They will invade into other tissues and are very good at it. The reason I'm also going over these characteristics of cancer is they'll have a lot to do not just with prognosis, but some of the ways that people are trying to develop treatments for cancer. So now let's talk about lymphocytes. This is the cell that starts to uncontrollably divide and defines lymphoma. So lymphocytes are a type of white blood cell. So they're obviously very important components of our immune system. So they're part of our body's defense against invaders. there are two main types of lymphocytes, B cells and T cells. And this picture on the right side of the screen with the arrows pointing to cells, those are lymphocytes. Those little discs with the central white areas you see around them are actually red blood cells. So you can see that lymphocytes tend to be kind of small cells, not much bigger than a red blood cell, and they circulate in our bloodstream. So what do these guys do? And again, the photograph on the right side of your screen with the arrow pointing to it shows a normal lymphocyte. Well, as I mentioned before, they're an important part of the immune system. B cells make antibodies. So these are the guys that if you get vaccinated, they're going to be stimulated to make antibodies. If there's an invader like a virus or bacteria, they make antibodies. T cells come in two types. One type can kill abnormal or infected cells, and these are commonly referred to as CD8 cells. And I think many of you listening probably have heard about CD4 and CD8 T cells because they become very critically important in people who are infected with the human immunodeficiency virus, or HIV. So CD8 positive T cells can kill abnormal or infected cells. CD4 cells provide help. So they're the type of T cell that provides help to other cells of the immune system. And they make substances and secrete them that, for example, make B cells be better antibody makers. They secrete substances that make CD8 or killer T cells actually be able to function. But they also influence lots of other cells of the immune system. And that's why when CD4 cells become depleted in immunodeficiency syndromes, it is a disaster because they're just simply not there to help other cells do their jobs in the immune system. So where are lymphocytes located? Well, bunches of places. We mentioned, and I showed you pictures of lymphocytes circulating in the bloodstream, and some of our lymphocytes are there. A lot of our lymphocytes are congregated in specialized areas called lymph nodes, and these are going to become critically important when we talk about lymphoma. They're also found in other organs, such as our spleen, our intestinal tract, and the liver. And the little diagram on the right, I want to spend a minute going over that because the dog there has arrows pointing to the most common lymphocyte accumulations where we have most of our lymph nodes. The first is the submandibular, and if you think about that, those are the glands under your chin. Those are the glands that become big when you get a head cold, and that means that your lymph nodes are doing what they're supposed to do, which is they're responding to an infection. The lymphocytes are getting a little bit bigger, they're producing antibodies, they're killing infected cells, and they're very easy to feel in the dog and the cat. So they're right there under the neck. The prescapular lymph nodes are right in front of the shoulder blades, and those are another area where those lymph nodes, we can palpate them even when they're a normal size in most dogs and cats. The next area I want to point to is under the armpit, and those are called the axillary lymph nodes. In a normal dog or cat, they're kind of tough to palpate if they're a normal size, but you can pick them up if they become enlarged. For axillary lymph nodes, for those of you out there who know about breast cancer, are the nodes that they get very excited about in women, and they check to see has the breast cancer spread to these nodes, because the axillary lymph nodes are one of the areas that breast tissue drains. So again, we can feel them in dogs and cats, but they're not very obvious. The inguinal lymph nodes are right in the groin area. And again, in a normal dog and cat, they're not very obvious, but they can become enlarged. Finally, I want to point out the popliteal lymph nodes. These are lymph nodes that are behind the knees. And these are lymph nodes that even in their normal size, you can usually feel or palpate in a dog and a cat. And again, for us, we have popliteal lymph nodes, but they're much more difficult to notice unless they're enlarged. So now let's get into the meat of the discussion, which is what is lymphoma? It is, as Liz mentioned, a very common type of cancer. And it's where lymphocytes divide uncontrollably. And that could be, think about where lymphocytes live. They could be dividing uncontrollably in the bloodstream. They could be in a lymph node dividing uncontrollably, or they could be in those other organs I mentioned, like the liver, the spleen, the intestines. There are many, many different forms of lymphoma, and I can't emphasize that enough, that as we learn more about this disease, we are subdividing these categories into smaller pieces. And they have some, the reason we're doing that is because that has, each different subtype has different prognosis and potentially treatment. The same goes for in people. There are lots of different subcategories of lymphoma. Now, one point I want to make is this was a common confusion when I was in practice. Lymphoma is not the same as leukemia. Leukemia is a different type of cancer. Can be a different, we know that leukemia is really a blood cancer. Lymphoma can sometimes be found in the bloodstream, but they're not identical diseases. Sometimes they can be difficult to tell apart, but they're not the same. Now, on the right side of your screen, on the top, I have that picture we saw before of the normal lymphocytes with red blood cells, and the arrows pointing to a normal lymphocyte. Below, I have a picture of abnormal lymphocytes, and you may see that they're big and they're lighter staining and they're a little bit irregular in size, and there's a whole bunch of them compared to the small and normal lymphocyte we see on the top. Now, they're slightly different areas. The top is a bloodstream smear, and the bottom is an aspirate from a lymph node, but you can see the striking difference between what these lymphocytes look like. So who gets lymphoma? Well, statistics suggest it is the most common type of cancer in dogs and cats. It is also a very common type of cancer in people, and many of you probably have heard it referred to as non-Hodgkin lymphoma. That's one type of lymphoma. There's Burkitt's, there's B-cell, there's indolent. There are a whole bunch of subtypes that are very well characterized in people. In dogs and cats, we're not quite there yet, but we are, again, learning more about this cancer and subdividing it. And the picture on your right of your screen, again, shows some abnormal lymphocytes, and the arrow's pointing to just one. But if you look across there, you're going to see a lot of different purple staining cells. Many of them are lymphocytes, and again, that variety in size is not normal. So, who gets lymphoma as far as our pet population? Well, it tends to be for dogs, and we have a lot more data about lymphoma in dogs than in cats. It tends to strike middle-aged and older dogs, and the average age is reported between 6 and 9 years of age. Now, cats, we know that cats are different, and they're different as far as their age range for lymphoma, and it tends to affect a much wider range of ages in cats, and it can depend on the site of cancer development. That doesn't mean that I haven't seen young dogs with lymphoma, because I certainly have. Doesn't mean I haven't seen cats, middle-aged to older that get lymphoma, because I certainly have. But in general, these are sort of the age ranges we see it most commonly. I want to emphasize to everyone that lymphoma can strike any breed, including mixed breed dogs, and they are at risk. However, breeds that have a higher risk include boxers, mastiffs, basset hounds, St. Bernards, Scotties, Airedales, and bulldogs. And we've got some lovely pictures of them here on the bottom of the screen. Now, I think a lot of you are probably out there listening, and if you have another breed of dog, particularly we always think of lymphoma being a problem in golden retrievers, for example. And it is true. We do see a lot of lymphoma in golden retrievers, partly because we just see more golden retrievers. So whenever you see a breed reported as a high risk, sometimes you have to take into account, well, how popular are these breeds? So for sure, a basset hound has a higher risk, but basset hounds aren't that common. So if you actually look at numbers of dogs, lots of golden retrievers, Labrador retrievers, and again, any breed, I want to emphasize that, can be at risk for developing lymphoma. So where does lymphoma develop in dogs? Well, the most common forms are, and I've listed them here, and by far and away, I think multicentric, which means affecting the peripheral lymph nodes, those external lymph nodes that you can palpate, is the most common. Gastrointestinal is also common, and that can take a couple different forms. It can be kind of a solid mass. It can also indicate a type of lymphoma that infiltrates down if you think of the intestine as a tube, it's kind of creeping down the walls of the tube, and we'll see that in dogs. We can also see what's called mediastinal, and that's just a fancy word for the lymph node in your chest. There's a big lymph node in there. It drains the lungs, so we can see enlargements of this lymph node in a patient that has pneumonia, but we can also see lymphoma there. We can occasionally see, and it's rare, skin forms of lymphoma, and these often take the form of sores that don't heal. They're not a discrete lump usually, it's more like a sore. There are other types of lymphoma, and we can see it in other places, but it's much less common. For lymphoma in cats, it's a really interesting disease. For many years in the 70s and 80s, almost all lymphoma that we saw in cats was related to co-infection with feline leukemia virus, and it was highly associated with lymphoma. Since we do a lot more testing for feline leukemia virus and the vaccine was made available, we see a lot less lymphoma related to feline leukemia virus infection. These also change the demographic, because we used to see a lot of young cats, because they're the guys who get feline leukemia virus. They usually die by 5 years of age, so we used to see a huge number of young cats with lymphoma. That is changing because of this change and switch in this preventative measure that we do in cats. However, we're seeing a lot more intestinal lymphoma. We're not really sure why that's happening. We don't know if we're just getting better at diagnosing intestinal lymphoma, or we are also seeing an increase in inflammatory bowel diseases, which are also seen in people. So we see a lot more Crohn's-like disease in cats. And it may be that we're seeing more lymphoma because we're diagnosing these cats and we're looking more closely at their intestinal tract. There also is a phenomenon that is well documented in cats, where cats with Crohn's disease or inflammatory bowel disease can have transformation of their disease into lymphoma. Siamese cats may be predisposed to this disease. However, we see a lot of lymphoma in cats. We see a lot of mixed breed cats. So again, any cat is really at risk for developing lymphoma. So lymphoma in cats is different because cats are different. And as I just alluded to, the gastrointestinal form is by far and away most common that we're seeing now. Again, we see a lot more intestinal disease in cats, and we're seeing a lot more of this type of lymphoma for reasons that aren't completely clear. Many other areas, however, in the cat can be affected, but they're rare, but not as rare as in the dogs. So you can see lymphoma in the nose of cats, which we've seen. The kidneys are another area we see lymphoma. Some of their internal organs, they don't tend to get multicentric or big lymph nodes as much as dogs, but they develop lymphoma in a lot more diverse places. So how can you tell if your pet has lymphoma? This is really tough. The clinical signs depend on the location of the primary tumor, but I'm going to tell you it can look like a lot of other diseases. So if you have gastrointestinal lymphoma, for example, in either a dog or a cat, they just look like they may have some vomiting, may have some loose stool. They look like every other GI intestinal disease. Occasionally you can pick up an enlarged lymph node in a dog or cat, but I'm telling you it's not that easy. Occasionally we'll see skin sores that don't heal. The picture on the right side of the screen, I'm going to walk you through this. This is a dog, and you can see that the red collar sort of on the right hand of the side of the picture. This dog's nose and mouth are on the left side of the picture, and the ear is on the top of the picture. The arrow is pointing to an enlarged submandibular lymph node. So again, those lymph nodes that are under the chin. And I have had clients over the years who are petting their dog or grooming their dog, giving their dog a bath, and they were able to pick up an enlarged lymph node. But I would tell you that in general, the changes are subtle. For people who palpate lymph nodes all the time, like your practitioner, that's subtlety we can detect that, but for most people it's really hard to tell. However, people bring their pets into their vet because they're just not doing well. Something is wrong, and then we can start our diagnostics. So how is lymphoma diagnosed? Well, here we get a bit of a break as far as in the clinic. We can often diagnose lymphoma with a fine needle aspirate, and what that is taking a very thin needle, the same size or smaller than what we use to vaccinate our pets, and we can put it into the tumor, aspirate some cells out, put it on a slide, and look at it and look for abnormal lymphocytes. So again, sometimes in the clinic, this is not a difficult disease to diagnose. Occasionally we have to do a biopsy, particularly if it's a tumor, for example, in an internal organ, or maybe our aspirate, we just can't tell if it's lymphoma or not. We can do a biopsy, and many veterinary oncologists will actually biopsy, for example, an enlarged lymph node. And again, the diagnosis is usually fairly easy to make on biopsy. Occasionally blood tests are needed. We're always going to do adjunctive blood tests to see how our patient is doing in general, but as I mentioned before, lymphocytes do circulate in the bloodstream, so occasionally we'll pick up abnormal lymphocytes in the blood. So how is lymphoma treated? Because we consider lymphoma to be a systemic disease, that means it's everywhere. Chemotherapy is the treatment of choice in most cases. Occasionally, we will do surgery and radiation or some combination, but that is not the most common mode of therapy. So I'm going to talk about cancer staging very briefly because it's going to have a lot to do with prognosis. And again, if you were with our mast cell tumor lecture, you heard a little bit about staging. And it basically just describes the extent of the cancer. Where is it? Has it spread? Is it making the patient ill? It can differ between different cancer types, so whether it's mast cell or lymphoma, but in general, the stages are fairly well defined. And in lymphoma, they're extremely well defined because, again, this is a common tumor and people have been studying it for years. So this is the staging system for canine lymphoma, and I'm sorry, it's a busy slide, but I'm going to unpack it for you and we'll walk through it together. Both for cats and dogs, the staging system is stage 1 through 5. By convention, and for reasons I can't tell you, it's indicated by Roman numerals in the dog. So stage 1 is just basically one big node or involvement of one organ. Stage 2 is involvement in local lymph nodes, so the lymph nodes in one region, for example, maybe the submandibular lymph nodes. Stage 3 through 5 are actually where we diagnose most dogs. This is where we find the lymphoma. Stage 3 is when multiple lymph nodes are involved, and this would be that multicentric form. Usually is going to be a stage 3 by the time we notice it. Stage 4 means liver and spleen are involved somehow. They may be the primary site or they may be involved with stage 3, a more advanced form. Stage 5 is the worst, obviously, and that means that the blood and the bone marrow are involved. For cats, because cats have to be different, people tried to use the staging system for dogs, but it just didn't seem to fit well with their types of lymphoma. So a new staging system is used by most veterinarians, and this is indicated by regular numbers. It's not, doesn't use Roman numerals, and it's stage 1 through 5. But it's quite different than dogs. So stage 1 is involvement of one lymph node, but it could be in the chest as well. Stage 2 is a tumor with local lymph node involvement or more than one tumor on the same side of the diaphragm. And what that means is either in your chest or above the diaphragm or below, which would be your abdomen. Or it's a single kind of collection of lymphocytes in the gastrointestinal tract. Stage 3, again, we're moving to more advanced disease. This tumor is on opposite side of the diaphragm, so the chest and abdomen are affected. All non-resectable abdominal disease. So when we're thinking about, I told you about how lymphoma can kind of creep down the intestine. That would be non-resectable. You can't do surgery on it. All spinal tumors in cats are stage 3. 4 is you've got stage 1 and 3 with liver and or spleen affected. Stage 5, again, the worst, and you're talking about involvement of the bone marrow. For cats, it also means nervous system, or you've got both. We also have 2 substages, and these are important because they actually have a lot to do with prognosis, even though they seem kind of obvious when you think about it. Substage A means that these pets are not that sick. And they come in, maybe they're feeling a little off, but they're really not showing significant signs, or maybe it's just an incidental finding and they're not clinically ill at all. B means that they are showing clinical signs related to their disease, their lymphoma. That doesn't mean they have kidney disease and they have lymphoma, but they're feeling lousy because of kidney disease. It means the lymphoma is making them ill. And I want to just say why I spent some time going over the staging system. Part of the reason that staging is developed is that if people are doing studies in lymphoma, everybody starts on the same page. Everybody's using the same system. Everybody knows what a stage 3B lymphoma is in a dog, and it gives us some kind of coherent way of comparing one study to the other. So now, how does chemotherapy work? We talked that chemotherapy is really the way you treat lymphoma. And I'm going to do a little commercial now for chemotherapy in dogs and cats versus people. I think all of us know people who've had chemotherapy, and it's really a devastating treatment for many people. They become ill, they lose their hair. We know people who've had infections because their white blood cell count goes down, or they become anemic. I can tell you that in dogs and cats, they do much better and tolerate chemotherapy much better than people. Part of that is because the focus is often different. For us, a lot of times we're working towards a cure when we treat a person with chemotherapy. In animals, it's often to get them in remission, to give them a good quality of life, to slow down the disease. So again, the philosophy is a little bit different, and again, pets do much better. So, but I want to talk about very quickly, how does chemotherapy tend to work? And it works usually in one of these 4 ways. And I apologize, it's not the greatest graphic on the other side, but the idea is to kind of give you an idea of these 4 categories. One is that they can prevent blood vessel growth. And this is a very active area of research. It's called anti-angiogenesis. Angiogenesis meaning make blood vessels. And there's a lot of new treatments that are focused on this particular aspect of tumor growth. Most of our chemotherapy falls into this category, which is just stop the cells from dividing and growing. And a lot of our common chemotherapeutic agents do just that. There are also new treatments that are focusing on, we talked about these cells being resistant to the normal death signals. Well, can we find a way of triggering specifically cancer cells to die? And again, this is an area of very active research. Finally, we tried to get these cells to just stop duplicating. Can we slow them down? Can we stop them? Maybe then we can do surgery. Maybe we can do something else. But if we can even hold them stable or get them to stop dividing, they're much more manageable. So this graphic looks at that first type of chemotherapy, preventing blood vessel growth of tumor. So we have on the left side a tumor nodule, and it gets better and better blood supply till it's tapped completely into the blood supply, and it's this big tumor mass. If we can apply things to stop that, and again, this is an area of active research. Morris Animal Foundation is actually funding a study that's looking at using a new drug to do just this, then what we can do is the tumor will just die because it's just not tapped into the blood system. It's not getting nutrition. Sometimes the strategy is used to just make tumors smaller, so maybe they're more amenable for surgery. As I mentioned before, the most common way that we apply chemotherapy, and it has been used for 50, 60, 70 years, as long as people have been administering chemotherapy, is to just stop the cells from dividing and growing. And the way they do this is they interfere with the cell cycle. And this graphic here on the right side of your screen shows the cell cycle. And what I want to tell you is cells are always, they don't just sit there. Even the cells that have reached their mature growth are always doing something. They're always going through phases of the cell cycle. So, and not all cells, they're not synchronized. It's not like, okay, all the nerve cells are going to go through M phase or G1, or they're all going to rest at the same time. They're all in different forms of cell cycle. And cancer cells are doing the same, and they tend to be, because they're growing, these guys are constantly in the cell cycle and different points of it. So different agents are given, different types of chemotherapy, to try to work at different stages. So you might give a drug that will attack cells that are in S phase, which is that red phase. Or you may give an agent that attacks them when they're in G1 phase. So hence the reason and if you've ever had chemotherapy or known people who've had chemotherapy, sometimes you rotate which drug you use. Now, chemotherapy works best in cells that are really active in the cell cycle and are really going through all these different phases. That also explains some of the side effects we see with chemotherapy, which is chemotherapy, since it's attacking cells that are dividing and growing rapidly, not only does it get cancer cells, but it's going to have some collateral damage by affecting cells that are normally very active. And what are those cells? Hair follicles. That's why people's hair tend to fall out, because those cells are rapidly dividing, and our chemotherapy, they're going to be much more sensitive to it. Blood cells. The average lifespan of a red blood cell is 120 days, so you are always making red cells. Well, they're actively dividing and growing, and so again, they're going to be very sensitive to chemotherapy, hence the reason a lot of people get anemic with chemotherapy. So you can see where I'm going with this. Cells that are rapidly dividing in our body that are that's just their normal business, like the intestinal tract, those guys are going to be much more sensitive to the effects of chemotherapy. Cells that aren't super metabolically active, like your nerve cells, your bones, are not going to have a lot of side effects from chemotherapy. We know there are 3 classes of chemotherapeutics, and I'm going to skim over this very quickly. There's cell cycle non-specific, which means these are like big guns. These are medications that will affect a cell no matter what phase they're in. There are phase specific, and that has to do with growth. And there are cell cycle specific, and those were the drugs sometimes that I mentioned before, which will target a cell at a particular part of the cell cycle. So we talked very briefly about triggering cancer cell death, and this is where there's some great, cool, new, cutting-edge research. One is the introduction of a suicide gene, or a gene that is incorporated into a cancer cell, that when the cancer cell starts to decode the information in that gene tells it actually delivers a signal to die. There are anti-tumor vaccines, and Morris Animal Foundation, we just finished a study and actually have an extension going where we're looking at this in horses, where a tumor is injected. So it's not that you give a vaccine to prevent a tumor necessarily, it's that you inject a vaccine, something into a tumor that calls over and attracts the attention of the immune system, which is fully capable of killing cells. And what it basically does, and this also is for these altered viruses strategy listed next, is it attracts the attention of the immune system to come over and kill the tumor. The immune system tends to ignore tumors many times because it sees it as self. It's a weird looking self, but okay, it's part of me and I'm just going to leave it alone. Anti-tumor vaccines, again, will put something into the tumor that makes the immune system recognize it and kill it. Same thing with viruses. You can put viruses into the tumor that target the tumor, and then the immune system, it doesn't quite recognize the tumor, but it recognizes, oh, there are these cells, and yeah, they're kind of weird looking, but oh, look, now they got a virus in them, and I got to get over there and kill them. So again, trying to harness the power of your own immune system to kill these abnormal cells. So, chemotherapy for lymphoma. I told you it is the mainstay of how we treat this disease. And there are lots and lots and lots of protocols described and tested. And these are constantly being updated and refined. And new drugs are being tested all the time in the treatment of lymphoma. The type of chemotherapy protocol you select, sometimes it's as much an art as it is a science. And it depends on lots of factors, including the species. We know that cats and dogs, their metabolism of drugs can be very different, and they tolerate different medications at different levels. We know the stage of disease may be important. We said that the higher the number of the stage, the worse, the more aggressive the disease. So we may tailor our chemotherapy to address that. The substage and the overall health of the patient. For example, we have some drugs that have to be excreted through the kidneys. The platinum compounds come to mind. They're often used to treat cancer. But if we have a patient that has kidney disease, we can't use some of these chemotherapeutic agents because the damage, they couldn't excrete it, toxicity level goes up, and what we might end up is hurting a patient and putting them into, for example, kidney failure, and that's going to be a much more serious problem than their lymphoma, which then we've got to ignore while we treat this other disease. So sometimes you have to alter protocols based on our patients if they have underlying problems. And this slide I know is scary looking, and I'm not going to go over anything. I just want you to know this is just a summary of some protocols that have been developed for the treatment of canine lymphoma. And all those protocols listed on the left side, all those letters represent a different chemotherapeutic agent. And again, people have been experimenting with these. They're refining this all the time. So you can see there are a lot of chemotherapeutic treatment options for lymphoma. So a couple terminology as we get to the end of the presentation. One is what's called the complete response or remission, and this is really our goal. We're not looking for cure necessarily. We're looking for a complete response. It used to be remission, but the terminology is changing. But you'll hear people use this a lot. If you see a veterinary oncologist or you have your own oncologist, you have a complete response. That means the disease may be there, but we can't see it anymore. The lymph nodes go back to normal. The GI tract, the intestinal tract, we can't find disease anymore. We may have what's called a partial response to chemotherapy, and this is where we have measurable change, but it's not a complete remission. We can still find disease. This may not be a bad thing. Sometimes this is fine, and especially if we can help the quality of life of our pet. We may have stable disease, which sometimes talks about partial. We may have a partial response, and we've established that the patient at least is stable. Nothing's getting any worse. We can also see that sometimes with a complete response. We have stable disease. We can have progressive disease, unfortunately, and this is what usually happens with our pets. Our chemotherapy may work for a while, but then they come out of remission and they have progression. Sometimes they have progression even if we give them chemotherapy. We just can't. We can't get their disease under control. Sometimes we have what's called rescue therapy. A patient may come out of remission, and this time they need a different protocol to get them back into remission or get them at least to a stable disease and not progressive disease state. Metronomic therapy is a new term that you're going to hear a lot. It's received a lot of attention in veterinary medicine. And this is a concept where you give low-dose chemotherapy persistently with the idea that maybe you're trying to achieve stable disease, no progressive disease. Maybe it's a drug that at very low doses will at least hold the patients in a certain with good quality of life. And it, again, has received a lot of interest, and there are numerous studies being conducted right now on the optimization of metronomic therapy. There is a concept of drug resistance, and we think of drug resistance really being a phenomenon we see with bacterial or infectious agents, right? We give an antibiotic, bacteria become resistant, we have to change our antibiotic. Well, the same concept applies for our cancer and chemotherapy. There are always going to be cells that may be resistant to a particular drug that we administer. Well, if we give a chemotherapeutic drug and we wipe out all the cells that are susceptible to that drug, who's left? Well, sometimes resistant cells. Who's going to grow and divide? Well, the resistance ones. So sometimes we can see drug resistance, which means we need to select another agent or a different protocol. So what's a prognosis? Well, it depends upon several factors. Primary tumor site seems to be of importance. The presence of other diseases, obviously, because it affects what chemotherapy we can give. The cancer stage, that's a no-brainer. You know, if it's stage 5, they tend to have a worse prognosis. We know that substage B, very interestingly, is very significant as far as prognosis. And just to give you an example, for example, if you had a dog in cancer stage 3, subclass B, they may have a worse prognosis than a patient with a stage 4 cancer, so theoretically a more advanced cancer, but if they're substage A, again, they may have a better prognosis. And in many different trials of looking at chemotherapy agents in dogs with lymphoma, interestingly, what always seems to tease out as an important prognostic factor is the cancer substage. Prognosis can also depend on species, and we'll get into that shortly. So prognosis for dogs, it can vary widely. In general, you'll see reported that dogs will succumb to lymphoma within 4 to 6 weeks if they are not treated at all. However, we can have dogs that can live out to almost 2 years with certain types of lymphoma and certain chemotherapy protocols. That's the best. Sometimes it's on the shorter end, and they have progressive disease in spite of our efforts. We know that T-cell type lymphomas, and many people will now divide, is this a B-cell lymphoma or T-cell, have a worse prognosis. And as I mentioned before, substage B is associated with a worse prognosis. In cats, again, they're a whole different ball of wax. They tend to have a lot higher incidence of low-grade tumors than dogs, which is good for them because they do much better with their low-grade tumors, and survival of greater than 2 years is not unheard of in all the low-grade lymphomas. Unfortunately, if they get the other end of the spectrum, intermediate and high-grade lymphomas, they have a worse prognosis with average survival of only 6 months, even with chemotherapy. So what are we doing here at Morris Animal Foundation? Well, we're getting to the end of our time, and I just want to let you know that we have spent more than $4 million on lymphoma-based research. The majority of that in the last 10 years, though we've been looking at it pretty heavily for the last 20 years. Again, it's a common cancer, and people are very, very interested in it. Our research encompasses just about everything, and I tried to touch on it as I was lecturing, but we focused on new treatments. Again, we have studies currently in progress looking at angiogenesis. Can we stop blood vessel development? But a lot of different treatments, sometimes revisiting old chemotherapy, types of chemotherapeutics. Can we use them in new and different ways? Can we find a different protocol? We've worked a lot on diagnostic tests. One particularly active area that we're funding is trying to tell the difference. We talked about intestinal lymphoma in cats and how difficult it is to tell from inflammatory bowel disease, and this is an area that we have been funding and are currently funding. Can we find a better way to tell the difference, since it has a lot to do with prognosis? And we're spending a lot on looking at genetic susceptibility. So again, we talked about susceptibility genes that might be able to be developed. Maybe we can identify at individuals who are at higher risk for developing lymphoma so that we can follow them more closely. We also, as an adjunct from our Golden Retriever Lifetime Study, this is the largest and longest study ever conducted in veterinary medicine. Our goal is to follow 3,000 Golden Retrievers from young age to old age or death. Cancer is one of our main priorities with this study, and we're looking for risk factors for diseases, which include cancers. And we're hopeful that the information we gather from this study will improve the health for future generations, not just of Golden Retrievers, but of dogs in general. So now I'm going to turn you back over to Liz, and we'll finish up.
Thank you so much, Dr. Deal. That was a really great presentation, truly very informative, so we appreciate it. Thank you. Before we get to some viewer questions, I do want to take some time to thank our many supporters that have made research into lymphoma and other diseases possible. We at Morris Animal Foundation love what we do, but none of our work would be a possibility without you. So thank you for all that you do. And as you'll see here on the slide, we also want to give a big thank you to our webinar sponsors who have made today's webinar presentation possible. Just like you, we know that animals enrich and bring greater meaning to our lives. However, nearly 6 million new cat cancer diagnoses are made each year, and cancer is one of the leading causes of death in dogs. To help fight this disease, Morris Animal Foundation launched Unite to Fight Pet Cancer to create awareness of the devastating effects of pet cancer and to highlight the urgency for increased funding for pet cancer research. The great news is that there are many ways that you at home can get involved and make a positive impact. One of the ways that you can take a stand against pet cancer is to memorialize a past pet on the Morris Animal Foundation Remembrance Wall. The loss of a furry best friend is indescribable, we truly know that, and remembering them, no matter how painful, is an important part of the grieving and healing process. Another way to be a part of the solution is to participate in our Cancer Incidence Survey. The purpose of this very short 5-question survey is to gain greater insight as to the prevalence of cancer. One of the best ways to stay ahead of cancer is to talk about it and share our experiences so that we can learn from one another. There are so many ways to fight back against pet cancer, and Morris Animal Foundation is thankful for the support of our donors who are uniting to fight. So now to some questions. We're definitely running over some time today, so we'll only get to a few. Remember that any of the questions you have submitted, Dr. Deal has graciously agreed to answer those within the next week here. So now let's get to it. Dr. Deal, we do have a question. One of the viewer questions, you mentioned several breeds that are predisposed to lymphoma, such as bulldogs, boxers, basset hounds, etc. Is there a genetic component to lymphoma?
That's a really good question, and I think people believe there are breed predispositions, and that is a question some of our researchers are trying to answer as they look at the genetic code in cells, and they're looking at dogs affected by cancer, dogs not affected by cancer in a particular breed. So that is ongoing, and hopefully we will get an answer. So again, we may be able to identify youngsters and be able to be more aware that they have a predisposition to developing cancer.
Interesting. Another question from a viewer, how come the immune system doesn't always recognize cancer cells? So you mentioned that the immune system should normally pick up on the abnormal replication of certain cells, so why doesn't it always recognize a bad cell?
And that's a really great question, and that's kind of the million-dollar question. And a lot of people are trying to look at that because we know that we will make abnormal cells just as part of our normal body processes, and we know that our immune system can recognize these cells and get rid of them. What we don't know is how does cancer start evading this surveillance system that we all have. And people are starting to tease that out. It seems that, again, the tumor is really masquerading as a normal, cell. So, again, if we can find a way to alert the immune system, and that's the idea with those vaccines, is to somehow change those cells so the immune system does what it's supposed to, and if we can harness the power of that to get rid of the cancer, it's a lot more targeted with fewer side effects.
Great. Another question, you did talk about how common and prevalent lymphoma is in cats and dogs. What about horses? Can horses get lymphoma, other species?
We do see it. We're starting to recognize it in some wildlife species, but it's so difficult. Horses don't get a lot of lymphoma. But our wildlife species are tough because we don't, unless they're intensively managed, like in a zoo, they may develop cancer and die out in the wild, and we just don't have any idea. But there is interest and concern about some of our infectious agents like FIV, we talked about that, and feline immunodeficiency virus affecting wild animal species. Is it going to make them more vulnerable to different types of cancer?
Well, I wish we had time for a lot more questions. Unfortunately, you gave such a comprehensive webinar review, so we appreciate that so much. Again, any questions that you guys might have, we will get to those at a later date. Dr. Deal will answer those. But if you do wish to review or share this webinar, we will make it available along with an accompanying handout on our Morris Animal Foundation website, www.morrisanimalfoundation.org, a little later this week, probably within a day or two. We know, again, that there were a lot of good questions out there. Dr. Deal will be getting to answer all those outstanding questions, and those answers will be emailed right back to you. I want to thank everyone out there for joining us for today's webinar. Before you sign off, though, we would really appreciate it if you would stick around and answer a very short, easy-to-answer survey. The purpose is so that we can enhance our future webinars. We really want to put out exactly what you guys want to hear about. We want to know what you want next. So stay tuned for that survey so we can get more insight as to what you guys would like in the future. Thank you, everyone, and I hope you have a great rest of your day.